Let me ask you kind of an uncomfortable question. If your doctor looked at you right now, like right this second, and said, based on your exact biology, here is the most statistically likely way your body will begin to fail after 60, would you want to know? Well, most people say yes. But then, they spend the next decade completely ignoring the exact peer-reviewed epidemiological research that could actually prevent it. Here's what I find absolutely fascinating. After years of looking into preventative medicine, there's this single piece of data that every single one of us has had since birth. It's probably sitting in a drawer right now on a medical card or some old hospital form, your ABO blood group. And no, we aren't talking about fad diets today. We are looking at decades of massive patient data showing that your blood type leaves a measurable fingerprint on how your cardiovascular system ages, how your brain holds up, and honestly, what's most likely to take you down. Today, this explainer is going to turn that raw biological data into a highly actionable longevity plan.
Okay, let's dive into this. Here is our roadmap for today. We're going to cover the unique vulnerabilities and the daily mitigation strategies for Type O, Type A, Type B, and Type AB. Oh, and definitely make sure you stick around for Step 6, because there's a secret modifier sitting on top of every blood type that changes your personal risk profile significantly.
Let's start with Section 1, Type O, gut vulnerability.
So for most of human history, Type O was an enormous survival advantage. It created these incredibly strong cardiovascular systems with significantly lower clotting activity. But this ancient blueprint creates a really dangerous illusion of safety in a modern body over 60. While the heart feels structurally protected, the primary vulnerability is actually the stomach. The stomach lining of a Type O expresses surface receptors that the bacterium H. pylori finds incredibly easy to attach to. It literally moves in silently, colonizes the gastric mucosa, and slowly breaks down that protective lining.
And left undetected, this creates a slow escalation from chronic gastritis to peptic ulcers and, in some cases, even gastric cancer. So if you're Type O and over 55, here are your early interventions. Simply request an inexpensive H. pylori stool or breath test from your doctor. Look, this isn't scary diagnostics. This is just targeted biological maintenance to prevent severe gastric issues down the line. Think of it like changing the oil in your car.
And here's your daily routine checklist for Type O. Since your gut is your main vulnerability, you've got to actively protect it. Limit your long-term use of NSAIDs, things like ibuprofen or aspirin, which literally erode the gastric lining over time. Eat fermented foods like kefir, miso, or kimchi to maintain a stomach environment that's highly resistant to bacteria. Also physically, Type O blood is associated with higher baseline catecholamine activity. Basically, that means your nervous system runs on more dopamine and norepinephrine. If you don't burn that off, it disrupts your sleep and probably makes you a bit irritable, to be honest. So 30 minutes of daily walking and 2 resistance training sessions a week are absolutely vital for your metabolic health.
Moving right along to Section 2, Type A, stress and clotting.
Type A actually emerged as humans transitioned toward agricultural living. Now, as a young adult, this gives you a massive immune advantage. You can mount a very aggressive response against viral pathogens. But as you hit your 60s, the story kind of changes. A landmark Harvard study tracking over 800,000 adults over 20 years found that Type A individuals carry a 5% elevated risk of coronary heart disease compared to Type O. That number is driven by the fact that Type A blood carries higher coagulation activity. Your platelets are simply stickier and the clotting proteins are way more active.
Now, what's really interesting about this intervention plan is the mechanism behind that risk. It's not just mechanical, right? It's hormonal. Type A individuals actually maintain the highest baseline cortisol levels of any blood type. When cortisol runs chronically elevated, it inflames and stiffens the endothelium, that's the inner lining of your blood vessels. And when that lining is inflamed, those naturally sticky Type A platelets preferentially adhere right to it. It's a compounding cycle. Because of this, getting your blood pressure checked every 6 months and monitoring homocysteine levels to check for arterial wall damage, these are critical clinical interventions for you.
For your daily checklist, keep in mind that Type A individuals trend toward those higher homocysteine levels, which, again, damages arteries. But the fix is remarkably simple. Get adequate folate, B12, and B6. You easily find these in dark leafy greens, eggs, and legumes. More importantly, though, you need to build a daily cortisol reset practice. 10 minutes of diaphragmatic breathing, 4 seconds in, 6 seconds out, every single morning. For Type A, daily stress management isn't just a nice wellness preference, it is literally direct cardiovascular medicine.
All right, Section 3, Type B, immune calibration.
Ancestrally, Type B emerged among nomadic populations moving across Central Asia. This gave them an incredible metabolic adaptability to process a huge variety of proteins, fats, and carbs. But the modern food supply is effectively a massive calibration issue for type B. Refined seed oils, ultra-processed foods, high fructose corn syrup, these generate much stronger systemic, low-grade inflammatory responses in type B than in other blood types. Simply put, your ancient immune system just doesn't know what to do with a modern donut.
Because of this really distinct immune signaling profile, type B individuals are highly susceptible to keeping their immune system in a chronically activated state. So your early interventions must include a direct conversation with your physician about autoimmune screening. This is especially true if you've been, dismissing unexplained fatigue or joint pain as just getting older. You also really need annual monitoring of your C-reactive protein, or CRP. You want to strictly keep that baseline below 1 milligram per liter to ensure your immune system isn't constantly in overdrive.
So here is your daily routine checklist to manage all this. First, relentlessly eliminate refined seed oils and high fructose corn syrup. You have to stop triggering that systemic inflammation at the source. Second, when it comes to exercise, type B physiology responds best to sustained, moderate-intensity movement. Think cycling, swimming, or hiking. You actually want to avoid high-intensity interval training, or HIIT, because it generates these sharp spikes in inflammatory markers during recovery that your type B body really struggles to clear efficiently.
Up next, Section 4, Type AB, Cognitive Defense.
Type AB is actually the youngest evolutionary blood type. It appeared when type A and B populations mixed at scale. It has an impressive immune tolerance, but this dual inheritance comes with a serious neurological cost. And this brilliantly illustrates that exact vulnerability, microvessel perfusion. See, type AB carries elevated coagulation factors inherited from type A, combined with a really complex antigen profile. Over decades, this creates microscopic, gradual changes in blood flow through the brain's smallest capillaries, which impacts your memory consolidation and processing speed. Because of this, type AB individuals carry a statistically elevated risk of cognitive decline, including vascular dementia.
The tricky thing is, these tiny blockages build up over 15 or 20 years before you ever even notice them. What this means is that for type A individuals, cardiovascular health and brain health are exactly the same conversation. There's literally no separating them. Your early medical interventions must focus entirely on arterial health. Strict control of your blood pressure, managing blood glucose, and constantly monitoring those cholesterol and triglycerides. Every step you take to protect your arteries directly protects your cognitive longevity.
Your daily checklist absolutely reflects this need for deliberate long-term cognitive defense. You need DHA. That's the omega-3 found in fatty fish because it incorporates directly into the cell membranes of your neurons. It protects them, maintains fluidity, and reduces neuroinflammation. Try to eat 2 servings weekly or take a high-quality DHA supplement. And sleep? Sleep is absolutely non-negotiable. During deep sleep, your brain's lymphatic system flushes out accumulated metabolic byproducts, including those amyloid proteins associated with neurodegeneration. You strictly need 7 to 8 hours a night. Chronic sleep restriction accelerates your biological vulnerability faster than almost anything else.
Finally, let's look at Section 5, the race factor and choices. Before we finish up, there is one more vital variable sitting at the very end of your blood type, the Rh factor. You know, that little plus or minus symbol? Roughly 85% of people are Rh positive, meaning they carry the Rh antigen on their red blood cells. The remaining 15% are Rh negative, and this is not just some cosmetically minor detail. Research suggests that the 15% who are Rh negative actually have a modestly different cytokine signaling profile. In plain terms, their immune system communicates differently, giving them a heightened sensitivity to inflammatory triggers. If you're Rh negative, every anti-inflammatory protocol we've discussed today needs to be implemented even more rigorously. So, the crucial point here is this specific medical scenario. For Rh negative women who are pregnant or planning to become pregnant and the baby might be Rh positive, this is a medically critical conversation to have with your obstetrician immediately. Rh incompatibility during pregnancy requires proactive medical intervention to manage safely. So always know your complete blood type, both the letter and the sign. As we wrap up this explainer, I really want to leave you with this perspective. The statistics are real. The risks are heavily documented, but they are absolutely not your destiny. I mean, I've seen type AB patients in their 70s with sharper cognitive function than people 15 years younger. Why? Because they understood their biological vulnerabilities and they built their daily lives around addressing them. The gap between your genetic predisposition and your actual health outcomes is enormous, and it is entirely bridged by the choices you make consistently over the years. Remember, your blood type is not a sentence, it is a map. And a map is only useful if you're actually willing to look at it. So what does your map say?
Does the profile we walk through today match what you've been experiencing in your own health? Let me know in the comments below. And more importantly, tell me what specific step from today's checklist you're going to take today to start actively managing your longevity. You've carried this body a really long time. It is definitely worth understanding exactly how it works.